if I'm so that I can adjust my voice accordingly. Okay, can you guys hear me? Am I audible?
Yes, we can hear you.
Okay, thank you. So we have quite a number of people joined in. We'll just wait for another 2 to 3 minutes so that some of the more candidates can join in. And let me just confirm that I got 2 messages from the candidates yesterday who volunteered for the today's practice. And can you guys identify yourself? I think one was Dr. Nagam on, I don't know if I'm taking the name properly. If you're here, can you please just raise your hand or comment? Dr. Nagam, I guess. Okay. And secondly, I got message from Dr. Namrata, wanted to volunteer as well. I'm not sure if anyone of them has joined yet. If you are here, can you please just raise your hand or send in a message? Till then, let me just share the presentation. Okay. Let me just introduce myself till we officially start. My name is Dr. Iqra Ahmed, and I am currently working in University of Child Health Sciences in Lahore. I have done FCPS in pediatrics, and I have done my MRCPCH exam. I cleared my exam in 2023 September date, and that was the first exam that was conducted in Pakistan. So after that, I've been involved with the teaching and all. And as you know, some of you might know that we try to do some active interactions on the group as well. And we try to answer your queries and get some discussions on. So it's a good opportunity for all of you as well. Um, we also try to do online sessions once weekly usually. And since a lot of you have been asking about Uh, yeah, a lot of you have been asking about the development practice session, so we have decided to do it today. So I think two of the candidates who volunteered themselves, I don't think that they are here. I think Dr. Nagam is here now. Are you here, Dr. Nagam? I can see your name in the participants. Let me know if you are still okay. So you did volunteer yesterday. Let me know if I'm taking your name right. Okay, so are you ready to start? Should we start the scenario?
Yes. Yes,
Is it
Achata.
Nagam? Is it Nagam, right?
Yes, okay. No.
Okay, good to have you here. Okay, so let me just tell you, I know most of you who are here, they might be knowing about the timing and how does the developmental station go. The development is the most uh, common, the most important in the sense that it has the maximum number of marks in the exam. So you see, every other station has either 6, 8, or 10 marks, and 12. The development station has total of a 12 marks, which is a major scoring station in your examination. And a lot of you, in fact, most of the candidates who are appearing for the exam are really scared of this, because this is something that we do not usually do in our practice, and we have to learn it, learn a lot of things through this. So development is a kind of scary for a lot of candidates, but let me tell you that if you practice the station really, really well, and if you keep on memorizing all the tables and everything, this is one of the easiest stations to score the marks. I've seen the people who pass, they get full marks in this station. The reason being because there are very limited number of things that are in this, that you have a very straight cut pattern. You follow the proper pattern of the history, you follow the proper the charts of the growth charts, that how do you have to ask, and you'll have a very straight cut answers. In regards to the other stations, in which obviously, you never know what's going to come in the communication, you never know what is going to come in the history, or especially the clinical stations. But in the development station, you know that there's a limited number of things that will come. Obviously, there's going to be a gross motor, a fine motor, both of them. So speech, and more recently, a lot of scenarios that have been coming along for the behavioral issues as well. So yeah, if you guys practice it fully, you are going to have good approach, and you're going to score well in that. The total timing of the station is 23 minutes. When the bells, before you start enter the station, you are sitting outside, and you are given a paper on which a scenario is being written. There's a little information on that scenario, based majorly the name of the mother and the name of the child, and a certain scenario, and then they're going to tell you that what domain you have to assess. So sitting outside, you have a paper, a pencil, and this development station card. You are going to write whatever you want to write, names or anything, and maybe you have some made some format for yourself. So you're going to make that work on that format, make that chart outside, that how you're going to take the history or something like that. Inside, when you go, you have 9 minutes to take the focused neurodevelopmental history. And in the 9 minutes, you are warned at 6 minutes that 3 minutes are left. After 9 minutes, you are asked to summarize the history in only 1 minute. This is a really crucial thing to keep in mind, that you have to do it in 1 minute, and you have to be very precise and tell all the important things. After that, you're getting 9 minutes for the examination, in which mostly you get to do the examination easily, especially if there's only one command. The examination is really, really easily done in that time, and you are going to do everyone, please just mute. Okay. Please just keep your mics mute. Okay, so in that 9 minutes, you are going to do your examination, and once you have completed your examination, you are going to narrate what examination, what gross motor development have you assessed, and what are the ages, etc. After that, you have 3 minutes. In those 3 minutes, you are asked certain questions, which usually include the issues with the child, the cause of the issues, what kind of delays there, what investigations are you going to do, and what management you are going to do. So for that, in 3 minutes, you have to have a very precise, clear approach, and something in your mind that you're going to tell it very quickly. You should have all the things on your fingertips that you're going to tell the management in this, and this form. And yeah, once you are done with all that, the station will be over. So we are going to do that exactly in the same manner. I'm going to share the screen. Dr. Nagam, are you ready? I'm going to give you 3 minutes. After that, I'll be shutting off the screen, and we'll be discussing the scenario.
Yes, Dr. Iqra.
Okay. This is your scenario, and I'll have 3 minutes. Okay, are you ready to start?
Yes, Dr. Chu.
Okay, let's start.
Hello, good afternoon. I'm Dr. Nagam, one of the child doctor in this hospital.
Hello.
I, be- I believe I'm talking to Joanna, mother of Sam. Hello.
Yeah, doctor, that's me.
Yeah. Nice to meet you, Joanna. Joanna, today I came to know about that you are concerned about some walking problem in the Sam.
Yes.
Uh, can you explain it for me?
Yeah, doctor, I believe I felt that my child doesn't walk normally. Yeah, and he's 2.5 years.
I'm
He's
really
two and a
sorry
half.
to hear about that. Okay, Joanna, can you please tell me when did you notice this problem?
Uh, yeah, I think I noticed it when he was around 15 months of age, and since my all other kids started walking at that age, he was not walking properly. And since then, I've just been waiting that maybe he gets better, but he did not started walking, and now I'm really concerned.
I'm really sorry to hear about that. Can if anything special happened at that time at 15 months of age or anything?
No, nothing special happened. No.
Okay. If you can tell me if there's a problem only in walking or in the other in holding the things or anything else?
No, he can hold things. He plays with the toys. My main concern is regarding the walking.
Do you notice that he has lost any skill that has previously gained? I mean to say, if he was standing and now not standing as well.
No, he does. No, I don't think he has lost any of the skills.
Okay. Okay, Joanna, I want to ask you some questions regarding the other developmental problems, whether just to confirm it, whether the same is not having this problem, okay?
Okay, sure, doctor.
Okay, okay, can you tell me if he holds the pen in any specific hand or in any of the hands?
I think he can hold pen in both hands.
Okay. Can you explain it for me that what type of that, like the adults, he can hold or he can hold in the three fingers?
No, no, doctor. It's just like how a child holds in his palm and he holds it like this. Can't hold it like an adult.
Okay. If I say him to draw a horizontal line on the paper, is he able to do it?
Yeah, I've seen him making lines on the paper. Yes, I think he can make lines.
Yeah. Can he make a circle?
I haven't seen that, no.
Okay. That's, okay. Can you please tell me if I give him the book, how he is turning, he will turn the book one by one pages or multiple pages at a time?
I think he can turn one by one.
Okay. And how much if I give him the cubes, how much he can make a tower of the cubes?
Doctor, I think he can make 6 to 7 cubes tower. Yes.
Yeah, that's good. Can you please tell me if he is able to drink with a cup?
Yes, he is.
Okay. Is he able to use the spoon and the fork?
Yes, he can.
Okay. And is he dry by day?
Mm, yes, I'm getting him toilet trained. He is mostly dry by day. Yes.
Yeah, that's so good. And if I ask him you about the speech of the same, can you please tell me if he is able to speak two words together?
Yes, he tries to make words together. Yes, now.
And what about the commands he's following? If I say him, go there and bring this book for me, is he able to bring that?
Yeah, doctor, you see that he cannot walk, so he cannot really do that thing, but he does understand when we tell him something that he does know that what has to be done.
Yeah, that's good. And can you please tell me if you have been previously been admitted in the hospital or any problem?
Our doctor, he has been admitted twice in the hospital.
And if you can tell me that you had any problem when he was in your tummy he had?
No, the initial, the ultrasound, everything was normal. I don't think anything
Okay.
specific happened in that time.
What about the jelly scans?
Yeah, they were done. They said the baby is small and his weight isn't very appropriate. Uh, Other than that, he was born at 34 weeks because I had early rupture of the membranes. My water broke. So yeah, he was born at 34 weeks.
Okay. Okay, Joanna, can you please tell me if he was admitted to the hospital at the time of the birth?
Yes, doctor, he had to be in the hospital for 2 weeks, I guess. And he was quite sick at that time. He had to be given some oxygen and he remained in the NICU. Okay, 6 minutes gone, 3 minutes left.
Okay. And what about any tests or anything special they told you about if he has some bleeding in the brain or anything
Oh, yeah, yeah.
infection in the brain?
Now that you ask, I remember that they did tell something like this, that he had some blood in his brain. And they said that's because he was born early. And after that, yeah, he remained in the hospital for quite some time. And it was a difficult time for us.
I'm really sorry to hear about it. It might be very difficult for you. Can you please tell me if he has been followed up with any team after that? I mean to say, any he was being assessed for development since then.
Um, yeah, I went to the doctors initially, but they said that he might had some other issues like fits or something. He had his issue of fits in the initial 6 to 8 months of life, and after that he did not have fits, so I did not go for the very regular follow-up.
Is he taking any medication currently for the fits?
No.
Does he taking any medication currently for the fits?
No, no.
Okay. And what about if I ask you what about the neck holding? Is what it is was it appropriate at the time?
I don't remember exact age, but I think it was okay.
And what about sitting?
Yeah, he was a bit late. Sat after 8 months.
Okay. And what about standing and walk?
Okay, so you can't ask, you have to assess it in your examination. You're asking about the gross motor.
Okay. And if you can please tell me who is supporting your family?
Yeah, doctor, my husband works, and I used to work before my baby was born. But now that he is unable to do his things, and I really have to take care of him, so I couldn't join my work back, and that has been an issue for me and my family as well.
Can you describe your family for me? Are
Yeah,
you and
it's
your
me.
husband related?
Yes, we are related. And it's me, my husband, and I have one elder child who is 5 years old, and this is my second child.
And that elder child is fine. Okay.
Yeah, he's okay. He goes to school.
Is there any problem in the family with the development of the children in your siblings or in your
Mm,
husband's?
no, doctor. No,
Yeah. Are you getting any kind of disability allowance for that?
no, doctor. Your time's up. Please summarize your case.
Okay. Okay. Actually, I got a chance to talk to the mother, Joanna, mother of Sam, 2.5 years old, who is she's concerned about the walking and according to my assessment, he's having he all the other domains are according to age of 2 to 2.5 years. And in the background, he was a preterm baby with a history of intraventricular hemorrhage, but and also the history of AIDS, but currently not on any medication. And According to the mother, he didn't remain on follow-up after 7 to 8 months of age.
Okay, you can start with the assessment.
Okay. I entered the room. I washed my hand. I introduced myself. Hi, I'm Dr. Naran, one of the child doctor in this hospital. Mm, and I asked about the same. Hi, Joanna. What the same is doing right now?
He's sitting in the mother's lap.
Okay. Can I get a chance to play with the same today?
Yes, sure, doctor.
Okay, thank you. Can you please explain me if he's having any kind of aid, hearing, or visual spectacles?
Mm, no, he has a walker in which the mother brought the baby. It's in the room. Other than that, uh, no other advice.
Okay, how he looks like? Is he has height, weight, and head circumference according to the age?
Yes, his height is on the 10th centile, weight is on the 10th centile as well, and OFC is also on the 10th centile.
Okay. And does he look any like any unusual facials or features?
No.
Okay. Okay, Sam, let's play. Can you come to and play with me?
Yeah, I want to play. He tells you yes, that he
Okay.
wants to play with you.
If I ask him to stand, is he able to stand without support?
No, he's not able to stand without support.
Okay. And if I hold him at the side of the table, is he able to stand with the holding the table?
Yes, he can stand with support.
And if I help him and ask him to cruise along the table, is he able to cruise?
Yes, he can take a few steps with the support.
Okay. And uh, if I ask him if I ask him to jump at a place, is he able to jump?
No.
Yeah. And uh, if I ask if I ask him to sit down, is he able to sit?
Yes, he can sit.
He can sit without support.
Yes.
Okay. And what about if I lie down him down and I start him to pull to stand, is he able to follow me through that?
Sorry, can you tell me again what exactly are you trying to do here?
If I want to in 360-degree maneuvers, I want to pull him up with my hands. Is he able to stand?
Yeah, he tries to do that, but I told you he can stand with support and he can sit independently.
Okay. And if I put him up and try to put him on my hand, what about the tone? Is he able to put the legs backward?
Okay, just to let you know that you have achieved sitting and standing. I don't think you need to go that back in your examination.
Okay. Then if I check for the reflexes, any neonatal reflexes that are present.
Okay, this is not a neurology station.
Okay. And other than that, I think
You still have 4 minutes. If you want to do anything, you can just ask or do.
okay. Um, okay, if I ask him to throw a ball to me, is he able to throw it?
Sorry,
If
throw a
I ask,
ball.
if yes, I give him a ball, is he able to throw?
Okay, he can randomly throw it with his hands, not in a proper direction. Yeah,
Okay,
but he can throw
and
it with his hands.
throw as well. Okay, is he able to kick the ball?
No.
He is not able to. Okay, and if I ask him to to go further upstairs, how he is going, by crawling or by holding the rails?
Yeah, he can crawl upstairs, but he cannot uh, go on foot.
Okay, can he come down while crawling or not?
No, he can only go up with crawling.
Okay, and if I stand him by the bicycle, is he able to propel it forward or not?
No.
Okay, and
So if you're done, you can explain findings.
that's it, I think.
Okay. Tell us about your examination. What have you done?
Uh, 2 minutes left.
Yeah, it's almost 2 minutes, but you can start telling me.
Okay. Okay, today I got a chance to play with the same 2.5 years old, chronological age of 2.5 years old, who's mother concerned about walking in the gross motor. He has a developmental age of around 9 to 12 months, because today he was able to stand up with a support and cruise along the along the table, and he was able to sit without support, but he was not able to stand independently or walk, and he was not able to he was able to go upstairs with crawling, but cannot come downstairs, and he was not able to do the propelling the cycle. So it's in the background of prematurity and developmental delay. He is a gross motor age of around 9 to 12 months, and in the rest of the things, he has age of around 2 to 2.5 years.
Okay. So what do you think is the cause of this condition?
It can be the prematurity and intraventricular hemorrhage that can lead to this spastic diaplegia.
Plastic diaplegia. Okay, right. And any other cause that you can think of?
It can be because of hypoxic injury at the time of the birth.
Okay. So would you call that this child is having cerebral palsy?
Yes, I will put it on the diaplegic cerebral palsy.
Okay. And do you think that he has an isolated delay or does he have a global delay?
I will put him into the isolated gross motor delay, because the other, all the other domains are between 2 and 2.5 years.
Okay. So how would you like to investigate your child?
Okay, first of all, I will review the complete further history exploration, and I will do the complete physical examination of the child, and along with the neurological examination and full development, complete developmental assessment as well. And then I will look for any investigations that were previously done. After that, I will go for the I will go for the neuroimaging of the child in the form of MRI brain, CT brain. And if I didn't find anything, then I can go for the metabolic workup as well.
Okay. What kind of metabolic workup can you think of doing in this child?
Uh, I would look for the first basic metabolic workup, including the blood gases and the urine examination. And other than that, I will go for the urine
Okay.
organ
So what will be your
insulin
managed?
analysis.
Okay, right. What will be the managed plant of this child?
I will involve the multidisciplinary team, including the consultant pediatrician, and I will involve the neurology team, and I will further involve the physiotherapist and occupational therapist, and I will make a health
So
education plan for
how
the
is
child.
physiotherapist going to help in your child?
Okay, physiotherapist will be helpful in doing the active and passive exercises of the lower limbs, and if need of any intervention, and
What kind of intervention?
any if any contractures or anything else for that, I will also consult the
Okay.
orthopedic surgeon.
How is the occupational therapist going to help in your child?
Occupational therapist will make some changes in the home environment, and if the child started going to the schooling, where to make it comfortable for the child to use.
Just one thing, the last thing, that the child was able to throw the ball. So do you think there's a discrepancy between the upper and the lower limbs?
Yes, he was able to throw the ball, but in the low, that's why I put him into the diaplegic CP.
Okay. And what is the concern about the education of the child? How are you going to counsel them about that?
I will make. I will contact the team of education health plan team, and then I will assess according to the development whether he needs a regular. He's able to go with the regular schooling or in the special school.
Okay. Okay. So time's up. Okay.
Yes.
Just give me a minute and then we'll have a discussion about that. Okay. So good job on in coming up and just being the volunteer here. So you did a good job, but there were quite a few things I would like to mention here. Before I start, would anyone else want to comment? Any one of you want to raise your hand and comment on how did the station go? Dr. Nagam, you want to do anything yourself? Okay. If not, then we'll just start discussing. We'll start with the history. Okay. And let's just starting with the history. You know that there are certain components of the developmental history. Whenever we are doing developmental history, we have to take a very focused history. There are certain parts of it. The first part is the detailed investigation of the complaint. Obviously, that in this station, the complaint was that the parents were concerned regarding um, the develop walking of the child. So you did ask, well, that when did it start? That when did they notice that, and how did it go? How? But one thing that always should be asked, that when they noticed it, did they do anything about it? Were they doing any physiotherapy or anything regarding that? Okay, so that was one important thing. The second important thing that I want to mention here is that we took a lot of very, very long history regarding the other domains. It's important to know about the status of the other domains, but considering that, you do not have to ask each and everything. Like in the fine motor, you asked about the grip, you ask about the lines, you ask about the cubes, then you ask about the book. You don't have to ask so many questions, okay? Because that is not a complete assessment that you are doing. You have to have a journal idea in the history that what's the age in the rest of the domain, right? Is it either normal for the age, or is it either uh good? Is it either just delayed or not? So you have to. You probably should just ask. I think I would just suggest that ask two questions per domain, and have a rough idea that is the child appropriate or not. So in this one, it might be just the drawing one and the cubes would have been enough. Okay. So don't go for very lengthy asking each and every question. Similarly, in the speech, just ask something about expressive, something about receptive, and the social as well. So because that took a lot of time of yours, because when I was timing, it was around 6 minutes, and you were just taking the developmental history, and all of the cause was unidentified till then. This was a simple case in a sense because there was a clear cut issue of being preterm and then an interventricular hemorrhage history, and that was a clear cut cause that what happened to the child. But there are so many causes in the examination and in the history, where there you might not be able to find the cause very directly, and then you have to have a very detailed history. So in my opinion, it's your personal choice. If you want to do the developmental domains first, that's your choice, but finding out the cause is a really important thing as well. You cannot just miss that. Okay, so in this case, if there are cases in which all of the things are normal, the history is normal, the development is normal, and the case did out to be a case of rickets, and the child had the gross motor delay due to the rickets. So in that cases, you have to ask a lot of questions. So if you will spend 6 minutes in just the domains asking about the developmental domains, you won't be able to complete other things, right? So that's another point, that you have to find the cause. You can do it first, or you can do the development first and then go for the other thing, right? These are the two things that. The third thing is that you have to ask for the other things as well. Um, Considering the developmental station, in this exam, uh, it's a really important to have a psychosocial history. It's really important to have a family history. So you did take about the family history something, but you did not touch about how the parents are. Like mother did ask to tell you that she couldn't go to work and she's having difficulty with that and things like that. Okay. So you have to have that. You need to also have the impact of the disease on the parents, on everyone, how they're dealing with it, support. You have to have good time to ask these questions, right? So never forget to ask about these. And this is going to be done when you are going to manage your history taking in certain components, and give specific time, and don't spend a lot of time on one section so that other sections are neglected. So if in summary, if you are asking your main the major points in your history should be the detail of your presenting complaint, the cause of the delay, the developmental assessments of other domains, and the psychosocial history. And if there's some time, then you can ask about the other issues, like maybe in some cases of the Down syndrome, you might have some heart issues, some thyroid issues, something like that, and have uh you have to take a certain history about that. Okay, so that's how you go with the history. After that, in the explanation, where we see in summary, that was fine. It was in 1 minute and you did fine with that. And but obviously, if you can obviously make the summary better by just telling all the important things and just negating the negative things. In the examination, when you started, I think that was, you need to have a bit of a practice. Everyone needs practice till the very last day of the exam. You need to have a very good approach. You need to have a good memorization of all the tables really, really, really well. Okay, so starting with the examination, you did ask fine. You take the permission and everything, and then you ask about the dysmorphic features, which was a good thing as well. And then weight, height, okay, OFC, you did mention. Then once you found out that the child was sitting, and then the child was standing, and then the child was taking few steps. You could ask about how the child is, um, what kind of walk is the child. The child cannot walk independently, but the child was cruising. Child can walk with support. You can have an idea. Always, if when a child is taking a few steps, you have to ask what kind of walk is it, because that is going to give you a very good clue. In the cases of hemiplegia, in the case of diplegia, you know that there's a specific walk. So you can ask just about the walk. You cannot ask about the tone, reflexes, power, everything, because that's not a neurological station. But the type of walk you can ask. Okay, which can help you. After that, you obviously you went back, that is the child able to sit. You could have asked about the crawling as well, and then when you ask about the crawling, you could have asked what type of crawling the child do. So obviously, if you would have asked, I will tell you that the child do crawling with the help of his arms and like the commando crawl, which would have made your diagnosis even clearer that he's having the diplegia. And then after that, you kind of get to have a little confusion. Obviously, you go back to this 360-degree maneuver and everything when the child is not following, is not able to do the developmental milestones of certain age. Like if the child was not able to sit then, or he was not able to sit independently or not even crawl, then you would have gone step backwards and do rest of the maneuvers, right? And once the child was sitting and crawling, I don't think other things mattered, because obviously that's for the ages of like 4 to 6 months or 6 to 9 months. Okay, so you did have an idea of that. So I think that was a bit of unnecessary. Then obviously there's are you we guys always remember, we guys always forget that in the gross motor we have to do the lower limbs, and obviously you have to ask some certain idea about the ball throwing as well. Okay, so when we started off later on, you did realize that you have to ask the about the crawling. Bicycle was or tricycle was unnecessary, because tricycle comes at the age of 3 years and the child was not even 3 years now. So I don't think that was necessary. But other than that, you did have certain block at many points when you did. Sorry, it seemed like that you don't have much of an idea of how things are going to go further, right? So in that cases, for that to tackle with that, we really need to have a very, very good memorization of all the things that have been written in the tables, and then you have to practice with each age. Like if this doesn't happen, then I'm going to ask this. If this doesn't happen, then I'm going to ask this, and something like that. So a well memorization of everything that can make it smoother. So this was just one domain for you to assess now, but in exam it might come as that you have to assess the motor, gross motor, and the fine motor both. In those cases, obviously you have to have some speedy uh, asking, and then because fine motor has to be assessed. So two domains can come in the exam. So you have to make yourself good enough that you can do two domains in this time period as well. After that, the explanation was a bit lengthy, but obviously you had the time, so you could use your time and tell in detail. Um, in between, there are two ways. It's don't I would That's my personal suggestion, that I don't really recommend that you just keep on asking the questions that can he do that, can he do that, can he do that. It's like that you are just asking a questions. Okay, you have to imagine yourself that you are doing development assessment of a child, and you are see that now I will see that if the child is able to do this, and I will see that if the child is able to do this. And like if you are assessing the fine motors, then in your exam say that, okay, I'll give him this and see if he can make a line, and then I'm going to put blocks in front of him and see if he can does this. If you are going to ask just the questions to the examiner that can he walk, can he do that, that gives a bit of a negative impact, that you are just asking certain questions and everything. Okay, so that's how the things go. After that, in the DDs, obviously it was clear that what the cause was. Investigation, we have to be very careful with the investigations, because in development we don't need a lot of investigations unless required. In the management, you were right, multidisciplinary team, you have to mention all the teams. You have to be very clear about the roles of the physiotherapist, occupational therapist, and everything like that. In these while describing the development in this case, you can tell that the child's upper limb, obviously he can able to throw ball, and seems to be normal, but there's a difference between the upper and the lower limb. And the lower limbs, the gross motor development is this because of this. Okay, so other than that, I think the questioning answer session you did well. That was fine. So that was the feedback from my side. If you would like to ask anything, if any one of you, we have, I think, 10 more minutes for the stage for our session. Any one of you wants to ask any question regarding this station or regarding anything regarding the development, you can ask.
Yes, hi Dr. Iqra and everybody. I'm Dr. Mazhar, working in Ireland at the minute, and just I need to add few things. Is that okay?
Yes, yes, go.
Yeah. So first of all, it was very good effort, and the few things I just need to add. When you are looking at the prompt and after reading it, make the things in your mind what your plan of action will be. And the most important thing is the opening sentence. While when you are asking from the mother, tell them that you have a letter from the GP in which it is mentioned, can you please, I'm going to assess for the development assessment. Can you please tell me in detail regarding your concerns? So asking for the concern is very important. Then it's right. So you have to go into the history of present illness as we are doing routinely in Pakistan. So just explore other issues as well. So the most important thing in development history is the bind history. You have to ask about the birth history is very important. Ask about perinatal, natal, and also in more detail rather than the past admission and every other step. So in development, whenever you are going into a development, so very most important question is ask about any concerns regarding the hearing, and if there is any issue regarding the VN. And as you already mentioned, psychosocial and family history very important in this case. And also first of all, you have to categorize either it is delay or regression. And Dr. Nazam did a great job that he started with that, and he was she was looking forward to it. And again, in examination, when you're assessing the development, so start with what the patient is doing at the minute what he's doing. So start from there and go upward to the limit where the child is not performing that thing that could be in his or her age group. So finish there, don't go beyond that. If the child is not walking, don't ask for is he hopping or is he able to jump or those developmental milestone that comes after that age. And like as you mentioned, like commando crawl, what kind of crawl he is doing. I want to look for the type of crawl he is doing at the moment. Like in cases of hemiplegic, you have to ask about what is the gait. You have to look for the circumductive gait or early hand preference. And while examining, like as you already mentioned, do a bit of running commentary as well. So by doing the running commentary, what will happen that it will give you some confidence, and you will be more fluent in your description. Thank you.
Yeah, thank you so much, Dr. Masad. That was really nice input from you. Yes, totally, because there was some things were missing in the history because a lot of time was spent on the developmental assessments. You can have general idea of how much delay is, or you can simply have a bit of an idea that either it's delayed or normal. Your main aim is to have to find out that the child is having global delay or just an isolated delay, right? And regarding other things, as you mentioned, that a good idea to just keep on interacting. It keeps you at ease as well, and it gives examiner a good thing that that you are examining the child and you are just imagining that you are examining the child, right? And obviously there are always things that needs improvement, but for development, the most important thing that to keep in mind is that just be focused on things that you have to do and just don't ask a lot of irrelevant questions. Just be focused do things nicely, and just try to be as confident and as sure about things. It was very right of Dr. Mercer to say that if you are getting to a certain point, that if the child is unable to walk, you cannot ask the child if this that can the child jump, or can the child run, or can the child kick, obviously, right? Because he's not able to do certain things of that sort. Okay. So yeah, do we have any other questions? We have to ask questions to the examiner. We have to perform development assessment of the patient. Okay, so you know that there have been changes in the exam. Initially, there were assessments were supposed to be done on the patients. Then the COVID era came, and all the things were online. After the COVID has stopped, and now there are face-to-face patients. Now that you have to do the development assessment on just with verbalizing. Okay, there are very few cases, and I've just seen in a very few stations when the examiner says that I have become the child and do the examination on me. But that's in a very few centers that I have noticed that. And that's in the cases when the cases of autism or something like that. Usually the examiner is sitting, he has a list of papers, he has whole key to his in his hands, and you are asking him step by step that now I'm asking the child to do this, now I'm asking the child to do this, now I'm observing this, and I'll see what the child is doing. And then the examiner tells you that this is this and this, some things like that. Yes, you have to ask from the examiner, and the examiner has a good 5 pages key, and he's going to go through that key, and he's going to tell you about the question.
Increase 125 vitamin hydroxyvitamin D synthesis and increase renal phosphate loss. So your calcium is going to be high, your vitamin D is going to be increased, and your phosphate is going to be the decreased one. So this is how the parathyroid hormone causes the calcium.
Okay, sorry, I think someone just unmuted themselves. Okay, so uh, what about in Pakistan station? In Pakistan station, it's same, that examiner is sitting and you are asking the things from the examiner, and but it does matter the way you are asking. Just make sure that you're not asking it like a questionnaire, that is the child doing this, is the child doing this, is the child doing this. Don't ask it like this. Make it like an interactive, something that, okay, I'll ask, okay, you cannot walk, let me see if you can just stand up, and I'll see that if the child is able to stand up, and then I'll see that if he's sitting, then is he able to throw a ball when he's sitting, is he able to make some blocks when he's sitting, things like that. You have to make it something like that you are imagining that you are examining the child, and be just comfortable, because there's at times when you have to assess the fine motor, there are certain fine motor toys present there. You can tell that I'm going to put this in front of the child and do things like that. Okay, do we have any more questions? Any comments, anything? Because I know development station is really hard. And so my final tips for you would be cause of regression, where best can we read about it? Okay, so for the theory purpose, the mark BT, that's really yeah. For the mark BT is good enough. You have the developmental part in the end, and then there is written a list of the causes, a list of abnormalities that have to be done. Okay, and what investigations could you go through? You can go through that. I think that's more than enough. Um, Cause of regression, there are some examples of regression that have come in the development station. Mostly that have come in this is the Rett syndrome, in which there is regression. Then there are case of the gross motor delay, in which the child had brain tumor or SOL, and he had this weakness after that. So you can have that as well. Yeah, so my tips for the development station would be make a proper chart about for you, a proper framework of how you're going to take history. Write all the important things that you're going to ask in the history, and so that you'll be very precise and you don't go wander around asking the irrelevant questions. And then just remember to revise your developmental charts daily. Remember, if you are going to give exam and your exam is maybe 3 weeks, 2 weeks from now, just spend 5 to 10 minutes daily. Put that on your phones, the charts, put them on your phones, and just keep on looking at them daily, daily, daily. And then make a scenario in your mind that you are going to revise all the developmental milestones of supposedly a 2 years old child, and then revise all those developmental things, all those milestones in your mind, so that you have that if you have a child of this age, you're going to ask this and this. That's how you're going to get fluency in the developmental station. Ma'am, in neurodevelopment history, first we take history and then examination. Yes, first 9 minutes are for the history. In history, you have to take the history of the presenting complaint. You have to find out the cause of the delay. You have to find out the domains. You have to find out the age of the child in the other domains. And then you have to ask about any of the other issues that the child might be having. And then a good family and the psychosocial history. Then you have to summarize it in 1 minute. After 9 minutes, you summarize your case in 1 minute, so it should be a very brief summary. After that, you are going to do the developmental examination in next 9 minutes. Okay, and in those 9 minutes, then you have to go for the examination and tell your examination findings. And then in the last 3 minutes, you are going to be ask about the diagnosis, investigation, and the management. Okay. Thank you so much, everyone, for joining in. I hope this was helpful for you. We'll hopefully be having another session next week, and we'll ask and have a poll on the group that what station would you like to discuss next. And your suggestions and comments are always welcome. Okay. Yeah, thank you so much. Thank you for joining in, and have a very good night, everyone.